I'm Dr. Terry Kilroy. I'm a pulmonary physician, lived in Lakewood since the early 80s, have had an office in Lakewood. I'm going to sit down because I've been on my feet all day. Okay. So anyway, and essentially what I want to talk about today is to try to put the healthcare and hospital debate in some kind of context of the city of Lakewood, because I think most of the citizens of Lakewood don't understand how unique we were, okay? My grandparents got off the boat from Ireland, where we saved civilization, and came to Lakewood, where they taught us some civilization. And so since then, I've lived on the west side of Cleveland, as you can probably tell from my west side accent. Okay? And my family's been involved in this hospital since my father's appendectomy at the age of 17, and he's 90-something right now. But what I think you have to understand is healthcare in Lakewood has always been unique for the last 100 years. And our perspective on healthcare really has centered around three questions. Okay, the first question is, do we have a responsibility to our neighbors? Do we have a moral and ethical interest that other members of our community who may be not as fortunate, not just on an economic basis, but on a health basis, do they matter to us? Do their lives matter? The second question that every generation has tried to answer is, do we have political leadership and representative government who will actually actualize that decision to take care of our colleagues and our neighbors? The third question is, how do we acquire the assets to be effective in that endeavor? If you go back through the history of Lakewood, Graver started the first hospital in the early about the turn of the century, to take care of people. And you have to remember, at that time, the original hospitals were not where healthcare was delivered. Healthcare was delivered in the home. The people who ended up in hospitals were those who had no family support. So basically, they were the persons who, whether rich or poor, had no family to care for them in their houses. So when Graver started this, he really started a hospital to take care of the people who could not be taken care of at home. Then, after the turn of the century, surgery developed, and we needed facilities to do surgery. Lakewood Hospital became the asset to allow surgeons to be able to do surgery on the people of Lakewood. By 1933, when there was a crash in the stock market and everybody was in trouble, all hospitals were in trouble, that generation of Lakewoodites answered those three questions. They said, first, yes, we do have a responsibility to our neighbors to see that their health care occurs. Two, we want representative government who will actually actualize our philosophical point. And number three is, they developed the asset, which was Lakewood Hospital, when they purchased it from Graver. Okay, and it became a city hospital in 1933. If you look at the history of the hospital at that time, it was the middle of the Depression. There were very few economic assets in the city. It was so poor, if you think about it, buying this hospital, that if you look at the original staffing of Lakewood Hospital, volunteers from the city came and cooked in the kitchen, they did the floors, they did all the volunteer work they could, because they felt it was important to develop the asset of a city hospital. Okay, I was fortunate that I came in here in '85, which is when we had the first change in structure since 1933 in the city of Lakewood, where we changed from a purely city-owned hospital to a hospital that was essentially a private nonprofit. The reason that was done was, since I was there, was the insurance market had changed. The city of Lakewood needed to market itself outside the confines of the city, which it was restricted to do by the state law. So in 1985, we made again the decision, one, do we take care of our neighbors? And the answer was yes. So we continued to, instead of unloading the hospital and walking away from it, we kept the hospital going. Number two, did we have political leadership who would continue that process and develop that asset and come up with a new structure for the hospital so that we could continue in a new economic model in the new insurance marketplace? And number three, are we going to continue the asset? In 1985, if you read the 85 agreement, it clearly says, if this doesn't work, the assets represented by the physical plant of the hospital comes back to the city, okay? And so once again, the city had asked the three questions that I began my speech with and came up with the same answers as those in 1933. Okay, in 1996, again, the marketplace had changed. Solo hospitals were having difficulty surviving just because the insurance contractors wanted to deal with multiple hospital systems to write one contract. And so we came up with another design in '96, again, answering the three questions. One, do we have a responsibility for the health care of our neighbors? And we answered again in '96, yes. Number two, do we have the political leadership? And at that time we did. We had Madeline Kane, who prior to being the mayor here, had sat on in the state legislature on the healthcare committee. So she was very aware of what's going on in healthcare in the state of Ohio and the needs and the changes in the marketplace. We also had Bob Seeley, who was the head of the city council at that time. If you remember, he knew the problems with healthcare from the inside, sitting in his wheelchair every day, okay? And so at that point in time, we were still, the community was still on the same wavelength, answering the same three questions the same way, okay? In '96, things began to change, okay? We brought the clinic in good faith, and frankly, I did testify against the merger because I had experience with the clinic for many years, and I felt they were not trustworthy and basically were oriented towards their own needs and not the needs of this community, okay? It went through anyway, but interestingly enough, Madeline Kane basically enlisted Pat Carey, who's one of the other doctors who grew up in this area, and myself, as kind of advisors on the sidelines. And so for her first couple of years, she did everything to maintain the asset, okay? To maintain the presence of the hospital to serve the city, not to serve the clinic. And they developed a large plan to move our services in various places, like moving psych out, moving cardiac surgery. And essentially what Madeline did is she said, the terms of the contract are you can't move services and I will sue you if you violate this contract, okay? And so essentially from about '96 to 2000, when Madeline Kane left, we established this running battle between Fred Loop, a couple of the doctors in the background, the law director, and the mayor to keep the city straight and level in the use of the hospital for our benefit, not that of the Cleveland Clinic. You have to remember the '96 agreement, the clinic really gave us nothing, okay? All the money we're talking about, everything that's spent, has always been our assets that's being used, okay? In about 2000, Madeline left, Bob Seeley left, okay? The next mayor, George, really wasn't that interested in healthcare and kind of faded into the background. And then things began to change, okay? The one thing that you have to remember in the background is the hospital is a magnet for physicians. So besides the physical plant of the hospital and the equipment we had, having the hospital allowed us to attract first-rate physicians into this community who not only worked at Lakewood, they lived in Lakewood. They were part of the committee. In '96, when the clinic took over, we had a 12-man orthopedic group based in that professional building. We had 5-man dermatology group in the one across the street. We had a cardiology group. We had 3 cardiac surgeons. We had 2 thoracic surgeons. We had 3 neurosurgeons who were doing 60% of the neurosurgical cases on the west side, all based at Lakewood Hospital, okay? So what happened? First thing the clinic did was to erode the medical staff. Most of you don't know how new doctors come into the community. We all come in under debt, okay? The only way that we can afford to move into an independent practice is we need salary support for the first year or two to get ourselves going, okay? Through 2000, we were usually acquiring 1 or 2 new doctors with support from the Lakewood Hospital Foundation or the Lakewood Hospital itself to get them established until they could be independent and run their own practices. We used that to replace physicians. Okay, the last one we recruited was in 2000. It was Dr. Rojas, who's an internist who was basically brought in to replace Jim Mulligan, who had been here for a very long time. Okay, what happened after the CEO? Basically, I used to take a lot of residents and medical students in my practice to kind of train them when they were on their outpatient thing. So I used to try and pick these guys off and have them join. So Dr. Rojas was my last resident that I recruited to come to Lakewood. Okay, what happened after he was recruited by the hospital is Fred Luke came to the CEO, who was named Ravonda at that time, and said, this hospital will no longer support the recruitment of physicians that are not part of the clinic. Okay, so from 2000 to 9, what has essentially happened is our physicians have aged out and left, died off and left, because essentially the clinic has used their position at the hospital to outmarket our local guys. They have essentially eliminated our medical staff. So we're down from since we're down from about a 10-man group of surgeons, we were down to one surgeon. When you look at the 25 or 30 internists we have, we were down to about 6, okay? Everybody else was basically replaced. A few were sucked up by the clinic. The primary internal medicine group in Lakewood is Carl Cully and Mary Walborn and Bob Colicaro. Where did they come from? Well, they were actually some of those independent doctors that were recruited with the financial resources of the hospital, started their own group, were in this practice, and so then were basically brought into the clinic. And so essentially what's happened since 2000 is basically our structural infrastructure, our structural asset, which is the hospital, has basically been degraded by the clinic. Our medical staff has been degraded intentionally by the clinic, okay? And so we're left with less professional and hard assets in the city in order to accomplish those 3 questions that we had from the beginning. So what we're really talking about now is, okay, what is the impact of removal of the hospital? Okay, how are we answering the 3 questions that everybody in the city of Lakewood have always answered? Okay, do we care about the individuals that we've lived near? I think the answer is yes. I don't think that we've really changed philosophically. Okay, number 2, do our elected representatives support that thing? Well, the problem is, I think at a superficial level they do, but they don't understand medicine well enough. And frankly, their sole source of information has been the clinic. Okay, so there's very little information they're getting independent of what they're being told by the clinic, which is a clinic-oriented perspective. Okay, what else have we lost in the infrastructure? Well, we used to have a Department of Health, okay? And so our politicians, Ed Fitzgerald basically, got rid of the Department of Health in the late 90s, okay? So the direct infrastructure, we need to know about what's going on in our community, to know that we're not having a Flint, Michigan lead poisoning issue, that knows when we had a large West Nile outbreak, that infrastructure we needed to take care of our people no longer exists. And so for a while we cruised with the hospital acting as the backup, okay? So we've already lost essentially the physician asset. We have lost the structural asset, the infrastructure of the Department of Health, all under the guidance of the current politicians, okay, and the clinic, who says you don't need them, okay? And now we're losing that last anchor to allow us to make sure that our colleagues are taken care of, okay? Now you can say all you want, well, you can go to any other hospitals in the city, there are other resources in the rest of the world that you can go to. The bottom line problem is we don't control those assets, we don't control those resources. We cannot guarantee that our people are taken care of. And so when I look at this, what we're really doing here is we're getting out of healthcare. I think the people still believe we have a responsibility to the health of our neighbors, but we're not going to have the political will to do it. We're not going to have the infrastructure because we have no Department of Health. We're not going to have the resources that we need. Now, what did the hospital asset represent? Well, at the time of closure of the hospital, we had $50 million in cash, okay? We had no debt. We had $30 to $40 million of mobile assets, which we had given to the clinic. I mean things like CAT scanners and cath labs and beds and the rest of it, okay? No reimbursement for that, okay? No reimbursement for the $50 million. According to the Subsidian Group, the hospital's worth $70 to $80 million. We have a professional building that was worth $1 million or so. We had the building in Westlake that, according to the state, the tax audit, was worth about $13 million, for which we got paid $6 million. Okay, so essentially what we've done is taken about $150 to $180 million and turned it into what? We get $25 million back, right? What's the problem with that? The $25 million is not coming back to the city. It is not coming back to us. So our asset has been put into a nonprofit, private organization that is A, non-discoverable, and number 2, not accountable to the people. So the chunk of change that we do get left, from about 150 to 180 million, we get 25 million back. It goes into a format that you and I cannot control. So essentially, whoever gets appointed to that board of that small group, that small $25 million outfit, is going to be self-perpetuating, and they have no accountability to you or me. And they aren't answering the same questions we're answering, okay? And so, you know, the big question here is, what this vote is really about is, will the citizens of Lakewood maintain control of how healthcare is performed in our city? Will we have the decision that we will take care of our colleagues? Will we have the decision of having a political leadership that will accomplish the goal we want? And number three is, most importantly, do we have the assets and infrastructure to make that real? Okay? There's hard medicine and soft medicine, okay? Soft medicine is you eat right, you don't do dumb things, and we'll all live forever. I mean, that's what we're being told by the mayor when he says we're going to come in with a new healthcare plan. We're going to eat better, we're all going to grow old, and we'll never die. I mean, I think Peter Pan said it best, okay? I'm a pulmonary intensivist, okay? I do ICUs, and I do critical care, and I do COPD, which is a tough disease. I'm in the hard medicine aspect. I want to see my patients get diagnosed by the right doctor, cared for by the right doctor, get the right medications, get the procedures they need in a timely manner that can actually save their lives and give them a chance to maintain functionality as they go on to meet their fate. And so my basic theory is we need to vote against closure of the hospital, against the loss of our assets, against the loss of the infrastructure we need to actualize what I think is important, which is we take care of our neighbors.
Yes.